The picture on the left is a blue baby. Our district health boards, since 2000, have paid much more attention to the environment in which we live. They're not there just to look after hospitals, they're there to look after the health of everybody, and our health is determined by the environment in which we live. Canterbury District Health Board have had an interest in the Canterbury Water Management Strategy and helped actually set it up. And that's because water has a profound effect on the health, and actually failing to deliver on good quality water means that we end up paying more for it, in the sense that we have to pay more to treat people who get sick from poor quality water. The comments on the water management strategy from District Health Board were that we should pay attention, particularly where there are competing interests for water uses. That means that Canterbury can sit on the Canterbury Water Management Strategy, but they can't vote on it. The implications, if we don't meet our targets, and we are not meeting our targets in Canterbury, is that we will see more sickness. We might see people dying. We've already seen some people dying. There will be fines if we don't meet legislative requirements for the community. And if we have to treat our water, it will cost us at least millions and possibly billions to treat what we currently have as an untreated supply predominantly. We do not want to end up having to chlorinate our water. Now, the infection pathway reflects the legislation. So first of all, I'm going to talk about how we protect our water. And most importantly, we have to protect our source water, which I here have labelled as our raw water. So we have human disease at one side, and we have the disease reservoir, which could be a number of sources waiting to infect us. Some of it can get to us through the raw water, some through a failed treatment process, and sometimes through the reticulation system. Any one of those systems can go wrong, and sometimes all of them go wrong. And when we have serious outbreaks, it's usually a failure of more than one system. So we have legislation to protect us at every level. In terms of our drinking water source, we have the Resource Management Act. And the District Health Board submits on resource applications, particularly where they might affect the quality of our water. And one example was the Central Plains water, which the District Health Board elected to oppose. Then we have the drinking water amendments. That gives drinking water assessors and medical officers of health the power to ensure compliance with drinking water. But we've seen that fail where drinking water assessors have not been supported by central government. And one example of that is Havelock North. And then we have the Building Act, which looks at our reticulation system and makes sure that our reticulation system is safe and functions. And it's expensive to maintain large reticulation systems, particularly in rural areas. And we have a number of tools under those. I've mentioned drinking water assessors, we've got the drinking water standards, and territorial authorities and building inspectors helping us with our Building Act. So what are the key health issues that we think about? Toxic blooms through our summers are something that we deal with almost on a daily basis in the Public Health Unit. We have to apply warnings where cyanobacterial blooms are detected. The period in which we have to apply those warnings is getting broader and longer. We also have to deal with elevated nitrates, and I'll talk about that in a bit more detail. But most importantly, we also have to deal with microbiological contaminants, and those are the things that actually kill people. There are many rivers affected by this. I'm not going to go into too much detail, but you'll all be aware that our rivers increasingly are affected for longer and longer periods in the summer. I'll quickly talk about nitrates. I talk a lot about blue baby syndrome, even though it's rare. But nitrates are the canary in the mine for contamination of other sorts and effects on our health of other sorts. So why are we at risk? Nitrates in our drinking water can be converted to nitrites in our gut. In an adult, that doesn't matter because nitrates become met hemoglobin and they're reconverted into hemoglobin and we can breathe normally. But if you're a small baby and your hemoglobin is converted into met hemoglobin, you don't have the enzymes that will reverse that process. And it's a bit like being poisoned with carbon monoxide. And we still see babies, particularly in the US where they don't have such rigorous controls, who get met hemoglobinemia every year. That's the immediate issue we're dealing with. It's a small but significant risk. And I've explained this, but essentially your blood changes colour in a baby that can't convert met hemoglobin. They essentially become pale, they go blue, and they can die. A breastfed baby will not ever develop met hemoglobinemia because nitrates are not passed on through breast milk. But there are other problems. There are other benefits of breastfeeding. Lactobacillus will help the baby change the kind of bacteria in its gut so it can deal with the nitrate conversion. The thing that some people often say to me is, well, there's loads of nitrates in beans and carrots, so what are we worried about? Well, yes, there are, but we're not supposed to feed newborn babies with beans and carrots, and I sometimes have to remind male farmers that they shouldn't be feeding their 2-week-old babies on beans and carrots. So here in Canterbury, as you've already seen, we've had nitrate levels going up and up and up, and it's essentially from cow urine and it's going up in our groundwater. And if we look at what the Parliamentary Commissioner for the Environment has said, I don't need to show you any more pictures of cows urinating, but essentially she has said the biggest source of nitrate in New Zealand waterways is urine from farm animals. That's not the same all over the world. In some cases it comes from fertilizer, and big pharma and big the agro fertilizer companies often are trying to promote relaxation of nitrate levels so that they can sell more fertilizers. In this country, it's really about cows. It's about cows because we have more cows, we have more farms converting to dairying, and we have more intensified cows on those farms. So more cows per hectare and more hectares for cows. So it has all sorts of effects, and one of the other things I deal with quite a lot is air quality, but I'm glad I don't live in Singapore, because in Singapore they've got poor air quality because the rainforests have been burnt down in their neighbouring Indonesia. The reason they've been burnt down is to plant palm trees to supply palm oil. One of the byproducts is palm kernel, which up until relatively recently most of our cows were being fed on. So down here on the left is a picture of the smoke running across Southeast Asia into Singapore. Of course, they burn the forest down, so it has an environmental effect in other parts of the world as well. And this is an orphaned orangutan as a direct consequence of planting palm trees. And Alison will talk a little bit more about this, but the feed costs of intensification mean that it isn't necessarily cheaper to keep intensifying your farming, but I'll leave that up to her. Canterbury, in terms of dairy expansion, is right up at the top here, and it's not particularly good news for water quality. The Parliamentary Commissioner of the Environment, in her initial report, assumed that there would be some offset of nitrates by planting forests. That has not happened. And even where good mitigation has happened, and there are plenty of farmers trying their best to have the best mitigation, what we've seen is that the water quality, and in particular nitrogen, from those good farms is not good enough to actually prevent the decline in water quality. I've got an example from the Hinds area. We're all very well aware, probably many of you here are aware of how poor the quality of water is in the Hinds area, where nitrates have gone up since the early 90s and have climbed steadily and are continuing to go up. So, of course, we now have the Managed Aquifer Recharge project. They're trying to kind of funnel water from the Alps into the groundwater in order to dilute the pollution. So what's happened across the province? You've seen some graphs like this already. This was in 2011. The red areas show where the nitrate levels are dangerous to human health. And since then, there are more of those areas, there are less of the safe areas, and those areas that were dangerous have got bigger. So by 2015, you've heard about Ashburton. Large areas around Ashburton now have very dangerous levels of nitrate. The irony is there are a lot of women who live in the Ashburton area who are on shallow bores, who are getting their water. These are women of childbearing age, and it's their babies that will be at risk. Often these women are working in the farming industry. So how do we protect it? Well, we have ECAN monitoring it. We have oversight by our drinking water assessors who work with the suppliers. We have a legal framework that I've spoken about, and we have drinking water standards which augment our regulations. It works well for community supplies generally, doesn't work quite as well for private supplies because they don't have to abide by all the standards that a community supply has to provide. I've talked about the multi-barrier approach. One of the problems is that nitrate can be removed, but it's very expensive. Quick word about the Canterbury Water Management Strategy, and in particular about its nitrate targets. It does have water quality in there, which is a good thing. The initial strategy actually only looked at quantity, not quality, but that was changed. But if we look at the last report, it says there's been some progress in terms of nitrates. When it looks at irrigation, which it also has to look at, it's been great progress. So I'll show you a little bit more up-to-date data. This is more recent. This is from the 2017 report that will be coming out shortly. And we can see that there's only 4% of the wells have shown a decrease in nitrate. A quarter of them have showed an increase, and nearly 3/4 have showed no decrease at all. And yet the target is that they should show a demonstrable decrease in nitrate by 2020. Now, the draft report showed that as progress. I'm pleased to say they've decided that that wasn't progress. They said, well, we are doing something. I said, so if you're pedaling very fast on your bicycle and you're sliding backwards down the hill, does that mean you're progressing up the hill? But you can see, once again, there's increases all the way across the Canterbury Plains. So we're not doing very well, and we're not even hitting the targets we've set ourselves. At least we've set targets, but we've got a long way to go, and it could take many decades before we reverse this problem. This shows how fantastically successful the Canterbury Water Management Strategy has been at irrigating our province. What are we doing? Well, really, we have an ambulance at the bottom of the cliff called the midwives, and so here they come. What they now do is they work with all pregnant women, and if those women have a private supply, as part of their booking, they get those women to check their water supplies for E. coli and for nitrates. They're able to check how well they're doing in their region, and actually, sadly for Canterbury, it's generally bad, and we provide them with a leaflet. Our doctors and midwives can now go online to identify what they need to do with a pregnant woman with regard to her nitrates and where she can get her water tested. If she finds that her water is contaminated with nitrate, she can only use bottled water if she makes formula for her baby. We keep reminding her, of course, that breast is always best. One of the ironies, of course, of our local dairy industry is that they sell formula to the Chinese. And when I pointed out to Sinlake that maybe selling all that formula was not something that would be allowed in this country because it's seen as unethical, they said, oh yes, but Chinese people like this formula feed. It reminded me a little bit of how we used to sell opium to the Chinese in the 19th century. It's unethical and we shouldn't be doing it. Nitrates are actually the canary in the mine for a number of different other problems, and these are microbial contaminations. And the other thing we have to remember is that we also have some of the highest rates of Campylobacterosis. And this graph shows how badly we're doing across all age levels in our region compared with the New Zealand averages. And that's because of the contamination of our water. We know what happened in Walkerton in Canada. There were 7 deaths. I'm going to read a piece of that because I think it's important to understand the personal feelings people have. Many of us here already understand that now from what happened in Havelock North. But Betty Trushinsky, she was one of the few adults that died in that outbreak, but her daughter said she died in the hospital away from her home, hooked up to machines and tubes in a coma. She suffered terribly for 10 days. She never had a chance to understand her illness. She couldn't put her affairs in order or say goodbye. There was no time. She just got sicker and sicker, and we were always 10 steps behind the illness. Her dreams of her retirement with Dad and travelling were stolen, all because the water was unsafe and nobody told her. I've had local politicians tell me that gastro is not a big deal and nobody dies from it. But there are some types of E. coli that are a significant cause of death, and for children are a significant cause of renal failure and can end up with enormous costs to our health service as well as tragedies for those families. We have other examples of outbreaks. We have the Darfield outbreak from 2012, where we had 118 cases of Campylobacter. Failure of treatment, flooding, and an infiltration of the water supply, very similar to Havelock North. Dunsandel in 2009, animal source, E. coli transgressions, a relatively shallow well. Then in the Springston outbreak, 50% of that town back in 2008 was affected by Campylobacter infections, and some of them had toxic E. coli, so we dodged a bullet there because many of them could have died. Havelock North, 5,500 people amongst 14,000, with 3 to 5 deaths associated with that particular outbreak and 45 people in hospital. A tragedy, and not a cheap tragedy either, it's expensive. Just one comment on the drinking water assessors, who in some cases have taken the blame for that. They were told in the first round of the report that drinking water assessors were too hands-off in applying the drinking water standards. They should have been stricter in ensuring the district council complied with its responsibilities. Our drinking water assessors, along with many others, try to get compliance from those suppliers regularly. They submit on various applications for irrigation and other things. They are never, ever supported by central government in their attempts to get compliance with the drinking water standards. And a consistent complaint in the submissions from drinking water assessors has been that the government constantly, when they say we want to issue compliance here, they keep being told, oh, we want a softly approach because you mustn't upset the minister. They are told that regularly. However, I have to say that they should be accountable to the Director General, and the Director General, that is the ministry, should be supporting them. It is in the law. It says so under the Health Act. So, yes, they may be blamed for not being strong enough, but at the same time, they need support from central government in order to do their jobs properly. Thank you.